we have one more tester to give us an opinion, and this is Dr. Adiatma Siregar, who's an economist at the Universitas Padjajaran in Indonesia. So over to you, Adi.
Yeah, thank you, Julie and team. First of all, big congrats. I think this is such a huge achievement and very useful as well in our journey to promote breastfeeding. And thank you also to NU, Life and Thrive, VHI, FHI, and partners for organizing the webinar and launching and developing the tool. So my name is Adiatma Siregar, as mentioned, from Center for Economics and Development Studies, CEDS, Universitas Padjajaran Indonesia, and our team consists of experts in various branches of economics, and one of them is health economics. And that's where I and my colleague, Pipit Pitran, who has been working with me on breastfeeding studies, and our health economics team jump in. So since 2014, CDS and Life and Thrive, we have produced some studies on costs of not breastfeeding, and the financial need to of policies to support breastfeeding. In one way, these can be treated as a part of value of breastfeeding, but we have never estimated the value of breastfeeding process and the value of breast milk itself. Therefore, we found the idea of the tool is very crucial, and important in promoting not just breastfeeding, but to promote the value of the monetary value of breastfeeding itself. Now, this is a very rare information, and this is where the tool fills this gap. And we found the tool very easy to use, informative, and especially in showing such a huge value of breast milk, breastfeeding process, breast and breast milk loss. I mean, these are very rare information. I mean, we cannot find this just anywhere unless we are using this tool as for now. So I have just calculated the value for my wife, for our 2 children, and that equates to 68,000 US dollars. It's just a huge amount, and this only covers variables that can be covered by the tool, right? I mean, we know there are more stories behind breastfeeding process. There's just so many variation in terms of experiences that we simply just cannot take breastfeeding and breast milk for granted anymore. I mean, there's just too many stories and values behind it. So we definitely need to acknowledge it properly. So when we try to use this, when I and Pipit tried to use this, we had some minor feedbacks only, such as probably the need for more information in several parts. But this, has been communicated with the team. So I believe the team has worked hard in accommodating those revisions. But otherwise, it is a very straightforward tool. So we believe this will provide more ammo for us in Indonesia and basically globally to fight for breastfeeding, and show that there are still more values to discover about breastfeeding and breast milk. The reality is, if it comes to advocacy, well, monetary value is more of a universal language. Let's say compared to a mortality or morbidity data. Sadly, that's the reality. I mean, for instance, if we said, well, breastfeeding, if we don't breastfeeding, that so many cases of diarrhea, let's say, will occur, and people will just say, well, okay, that's too bad, that's a pity, etc. But then we say, well, this disease, if you don't breastfeed, it actually costs this much in terms of cost, right? And people start to say, well, wow, that's a huge number, but of course it's a huge number, right? It has always been a huge number, of not breastfeeding. I mean, the consequences of not breastfeeding has always been a huge monetary value. But then, this is where this kind of tools play a very important role. We just need to share this information with people. And in terms of advocacy, this is just a very important information. So we still have a long way in advocating for breastfeeding in Indonesia. I mean, we have, for instance, different understanding in different parts of Indonesia. Indonesia is a very huge country, it's very diverse. And the existence of BMS products, socioeconomic factors, leave, maternity leave versus working, etc., lactation rooms. These are just to name a few. So we still have a long way to go, but this tool is definitely bring a welcome, valuable information in our journey. So thank you again, Julie and team, and hopefully we have a successful process in the future. Thank you.
Thank you so much, Adi. And as I said before, we're deeply grateful to all our testers who worked with a different version of the tool. It's not as perfect as it is now. Thanks to the hard work of Alex and team, we're pretty happy with it. But we really couldn't have done it without our testers.